Hello, I'm Dr. Bill Gradishar, Professor of Medicine at Northwestern University, and I'm pleased to have you participate in this Yerbba YouTube video that's focusing on overcoming and recovering from the effects of chemotherapy. If you'd like to get more information about personalized treatment paths, including the different therapies that are available that might be appropriate for your situation, tailored to your tumor biology and health profile, you can get a Yerbba report which breaks down chemotherapy regimens, endocrine treatments, and other combinations and provides specific information that may be appropriate for your case. And you also have an opportunity to interact with Yerbba's medical experts directly for evidence-based answers about your options, recurrence risk, or side effects from the therapy you have by going to yerbba.com. Whenever we talk to a new patient about the need for chemotherapy, we obviously talk to them about what the rationale is, what benefit they might derive, but we also talk to them, as we do with any therapy, about the expected side effects that might be experienced. And when we are administering chemotherapy, most of the things that we talk about are very predictable. We know they're going to happen. And the big issue is, once completed, how quickly do those side effects resolve? So the first thing is, different chemotherapies have different side effects. So when we're describing what we expect from a chemotherapy drug or recipe of drugs, it takes into account the composition of the recipe. And that is not only the acute side effects, that is the side effects that the patient experiences while receiving the treatment, but also what the expected recovery time is once the chemotherapy is completed. And we often separate these things into what we think of as rapidly resolving or things that can take a bit longer to resolve. And patients are very eager to get back to their normal life and feel as normal as they can, but we have to set expectations so that patients know that in some cases, certain side effects may take some time to get over. And there are certain things, even the emotional side effects of going through cancer therapy, that isn't something that's predictable. It's a patient-to-patient kind of thing, and some patients bounce back very quickly. Others have a delayed time until they feel like they're back in the swing of things with their normal life. So let's talk a little bit about the side effects. The acute things, or the things we expect to go away the quickest, are really a reflection of what chemotherapy does. So chemotherapy is most active against rapidly dividing cells in general. And you can think that a desired effect is that would affect the cancer cell, but it also affects normal cells. So blood counts, which are your red cells and your white cells, those are things that your bone marrow makes, and you can see the acute effects of that while getting treatment because you get your blood counts checked to make sure they're adequate. Once chemotherapy is done, your blood counts generally start to come back towards normal fairly quickly. It may take some time if you had anemia before you get back to normal levels, but the blood counts often come back fairly quickly. Now that said, when your blood counts are low, one of the things that patients can feel is fatigue, and we'll come back to that in a bit. The other thing that is rapidly dividing are hair follicles. So when you're receiving chemotherapy, it's very common, depending on the drug again, to experience hair loss unless you're using cold capping, which is pretty effective, but not 100%. Once chemotherapy is complete, we anticipate that your hair will start growing back fairly quickly. But again, setting expectations, you're not going to have the full set of hair that you had or the hairstyle you had in a couple of weeks. It's going to take many, many months. The other thing is the composition of the hair. It might be a little softer, thinner. You might experience some curliness to your hair that you didn't have before. So it may take some time, over many, many months, for you to get to the normal length and style that you had before receiving treatment with chemotherapy. The other things that I should have mentioned at the outset is nausea. So we often describe, depending on the chemotherapy drug, that nausea, even vomiting, can occur. We often and always actually give antiemetics that patients have available. So if they do feel queasy or nauseous, we have a maneuver to try and offset that while getting treatment. So once treatment is done, we expect those side effects to go away immediately. There shouldn't be any lingering nausea once you're done with therapy. And then if you move on to some of the effects that might be delayed in resolving, I mentioned earlier that although numbers may improve, in other words, your blood counts may get better, the fatigue that you experience from chemotherapy may take much longer. And the reason for that is you oftentimes become deconditioned during chemotherapy. You're not doing your normal activities. You're not as active as you were. So it takes a while for you to overcome that effect of treatment. And in different patients, it may take different durations of time. But one shouldn't be surprised that that could take an extended period of time before you feel 100%. The other thing that patients are often familiar with is this concept of chemo brain. And again, chemo brain is a poorly defined entity. It's something that is sort of described by many patients as feeling foggy, not as sharp as they were before. It's poorly studied. There's no complete adequate treatment for it, except usually time. And what we find is that with the completion of treatment, and by the way, this can occur or has been described not just with chemotherapy, but with other therapies, including anti-hormone therapy. And this mental acuity may take some time to resolve completely. And in some patients, they seem to indicate that they never felt quite as sharp as they did before they got chemotherapy, even once they're completing all their treatment. But for most patients, that fogginess lifts and people have the same mental acuity they had before starting treatment. The other thing that can sometimes be chronic and not immediately resolve is neuropathy. And again, neuropathy is something that's described by different patients in different ways. It could be a numbness in your fingertips or toes. Sometimes just the sensation is altered. And this is often attributed to specific kinds of chemotherapy drugs like taxanes. And using that as an example, once you're done with chemotherapy with the taxane, we wouldn't expect in the next few weeks, if you experience neuropathy, that that's going to go away. We would expect over a period of weeks and months that the intensity of the neuropathy would diminish, and over, in some cases, even a longer period of time before it completely resolves. And some patients can have some lingering level of neuropathy even many years later. So for most patients, there's an improvement over a period of months and you don't really think about it anymore. Some patients have a longer duration of neuropathy. One of the things that patients often notice is that they don't feel their usual self even with the completion of chemotherapy. It's what everybody looks forward to. They don't want to be treated. They don't want to be experience the side effects that I've described. But once done, some patients may still feel a little bit blue, not feel as they did before they started this journey with chemotherapy and their overall cancer diagnosis. So the treatment itself can take an emotional toll. And that can be attributed to a number of different things. The stress of knowing you have a diagnosis of cancer, experiencing the treatment and the side effects related to it, probably your lifestyle having changed during the period of time during treatment. It's obviously an inconvenience. It may affect your work, your family, your other activities. So all of these things sort of congeal at the same time. It can have an effect on one's psyche. So again, that may take longer to resolve, but we try to encourage patients to get back to their routines. And once they start feeling more energetic, this usually improves and resolves, but it can take some time in individual patients. So what we tried to cover in this Yerbba video was the consequences of getting chemotherapy and how quickly you recover. And as I mentioned, there are certain acute things that will go away very quickly, such as improvement in your blood counts, the nausea and vomiting resolves, your hair starts to grow back. However, there are other things that may take longer, including neuropathy, the concept of chemo brain that affects some patients, and just the emotional toll that it can have on patients. So I hope you enjoyed this and found it instructive, and we look forward to seeing you next time.